Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Andressa, a patient advocacy expert. Andressa, why don't you tell us about yourself and what you do?
Yes, of course. Thank you so much for having me. My name is Andressa Hunsel, and I am indeed a patient leader when it comes to sickle cell advocacy, but also for chronic hives. And on top of that, I'm also a children's book author about sickle cell disease. It's Kimaya and the Beach, My Journey Living with Sickle Cell. And I also produced two 2D animation movies in Dutch and English about my published book. So that is a little bit about me. I write different articles for WebMD and also for Health Union when it comes to sickle cell and chronic hives. So that's a little bit.
So, I want to ask how many years have you been kind of working as a patient advocate and performing this advocacy?
It's a couple of years now. I think my daughter was around 5 when I really started. So that is now 7+ years. Yeah.
Wow, that's incredible. Why did you decide that this was kind of a need that you wanted to fill with this patient advocacy?
So a couple of reasons why. Because first thing is that when you're in the middle of figure everything out as a caregiver, you literally see where there are hiccups and that there are things that need to be better. Things like communication with the doctors, medication providence, stuff like that. And at a certain point, also, of course, when you see that people are not aware of what sickle cell is, and that can make it very challenging when you need, for example, support from work, right, or friends. So for me, it was very important that knowing the fact that I am able to make these changes due to the fact that I'm really advocating for her, but also for myself as a caregiver, it really triggered something in me to make sure that I'm able to help others as well so that I can, increase the quality of life for more families.
That's incredible. Yeah, what an excellent kind of motivation that you have. That's really, really beautiful.
Thank you. I really want to encourage the hospital, but also, with including the medical team. When a sickle cell patient knock on the door, believe them. Nobody gets out of their house to chill at a hospital. They're there because they need help and they can't deal with the most of the time the pain. Pain is one of the most common side effects of sickle cell, right? And there are many more other awful experiences our warriors, we call the sickle cell patients warriors, that they experience. But we always try to manage whatever it is we need to deal with at home. When we see that we can't make it better at home, that's when we try to seek help at a hospital, right? So the moment that we are at a hospital, it's really because we need help and we're desperate to get the best of the best help and support from the medical team. So instead of saying what a hospital don't do this as a hospital, I want to do is basically switch it and say do this, right? So that is the first thing. The second thing is make your patient feel heard and understood. And that means that the first people we are in contact with when we're entering the hospital is basically the customer service department, right? Because they're really asking all these questions. So it's also important that they are aware of all the different codes and the waiting times for our warriors, right? So we need to educate them as well. The NHA, they have like these guidelines, right? Where they guide you like, okay, a sickle cell patient, they need to get treated by code 2, not longer than 30 to 40 minutes, etc. And if they are aware of that, that's make the whole process much smoother. The second touch point that we have are the nurses, right? The nurse is basically the person that comes in the room first, right? So they need to be aware of what's going on as well. So we need to be quick. There is no time to lose because the longer your body is in stress, the worse it can get when you have a crisis at that point. So these are basically Education is very important, making the patient feel heard, respect. Another thing as well is that when a patient is in so much pain that they can't, communicate in a way that they would normally do, don't feel that a patient is attacking you with words, right? It's just based on frustration, based on the fact that they don't know how to deal with the pain anymore. They want help, 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 right? So to be able to put yourself, like empathy is basically the right word, right? To show empathy so that they know, okay, I'm in safe hands. And then at a certain point, you will see the switch as well when it comes to the patient, that instead of being frustrated, the moment that a patient see that, oh, okay, he or she is trying to do his ultimate best to make me feel better, and they're listening to me, they're respecting me, then you will also see that the patient will, slow down and be like, okay, I need to work with them because it's teamwork at the end of the day. I always say this to my medical team: the medical team needs to understand that, for example, I, as a mom and a caregiver, when I move to another house or city, the first thing I look up is what is the best hospital? In this case, the best pediatrician hospital, right? At a certain point, my daughter's gonna be an adult. So when I'm going to move around, I'm looking at the safest place for my daughter because in case we need help, I need to make sure that I'm close to a certain area because of the fact that the hospital is there. So I hope that answered the question.
Yeah, definitely. How do you teach clinical staff to communicate in a way that makes patients feel heard? What are some strategies that you've done that help with that?
That's a very good question. And I've done it in a couple of ways, right? I've had situations where I saw, based on the response that I got from, the medical staff, that they had no idea what was going on. And for me, it was also, you learn via failure, right? When you make mistakes, etc. So what I did at a certain point, there is this book, and I'm gonna grab it. There is this
Yeah.
book that I started to carry with me all the time because I was like, it's very important for the medical staff to see what it is. And if they are not aware of what's going on, right? CDC guidelines. CDC is online, right? CDC has an amazing guideline when it comes to sickle cell anemia. So that is one. Another one, and this is really my Bible. This is what I really used when I was figuring it out myself. And when I saw that things are not going as it's supposed to go, especially at the ER, right? That is where people, because when you go to the hematology department for regular stuff, the hematology staff, they are educated on all the different blood disorders, right? But people in the ER, they're not specialists. They need to connect with the hematology team. So Hope and Destiny was really my go-to book at a certain point, where I was like, okay guys, listen, it's my role as a mom to make sure that they are aware of whatever is going on, right? At a certain point, when my children's book was published, I made sure I had copies when I go to new areas, etc., so that I can give them a book. Because when someone get a gift, they're excited, so they
Oh
gotta
yeah.
read it for sure. Because oh my god, this is so cute! Thank you. Next time, when another patients go there, another warrior, they know already what it is, and they're gonna be eager to know more. So these are different things. Another thing that I also do to try to educate our staff in hospitals, after, at a certain point, I felt a little bit, how do you say that, helpless, because I saw that it was so messy. I had a very messy experience at an ER with a nurse, and I was able to fill out a survey, right? I never thought that someone was going to read my answers. But as a mom, I felt so helpless and frustrated. And I was like, I'm just going to put everything there, share my story. And if someone listens or read it, it's all good. And for me, that opened a very big door so that I was able to join the patient and family
Oh
advisory
wow.
group.
So they
Yes,
recruited you from that survey to join the that's
yes.
incredible.
So that was amazing. That was really amazing.
And so
So
you were able to provide them with good feedback then.
yes, I am able. And the beautiful thing of being part of the PFOC is that it's really sharing the real life stories and experiences with the right team. Because, for example, we have presentations from the president of the hospital group, we have presentations from the HR manager, from the nurse director. So all these people that are, setting all the strategies and, deciding, the leadership team basically deciding which way to go with the hospital, these are the people you want to be in front of to be able to share your knowledge and to share your experiences, right? And I always say, knowledge is power, right? And when I share my experience, it doesn't matter if it's good or bad. I share everything, but I share it in a respectful way because I need to be smart too. The way I present myself, that is also that's gonna decide what people are gonna do with it. If I'm gonna be there screaming and yelling and no, 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 people are not gonna take me serious and they're gonna think, oh my God, that woman is crazy, right? But I need to use my strategy in a respectful way, communicating because we're looking for a sustainable solution and a sustainable way because tomorrow my daughter is an adult, but I made sure that not only for my daughter, right? All the pediatricians that are coming after her, people will know what sickle cell is. They will know how to treat them and what's okay and what's not okay, right? And when she is an adult, I'm now preparing myself and my princess for the fact that she's going to be a grown up at a certain point and that I lead by example, right? She is watching me talking to all these people. When something is good, what do I say, right? When something is wrong, how do I react? And that is
That is
very important. Yeah.
that is a wonderful example that you're setting, and the work.
Yeah.
I think it's a very selfless work. I mean, even though it's your for your daughter, it's also like
Hmm.
you're saying for all of these other daughters out there or these
Yeah.
sons out there that are facing this.
Hmm.
What are some successes that you can share? Maybe just one or two that you can think of where it was not a good situation at first, but we turned it into something positive.
So one of the most beautiful things I had was this, and one was this week actually. But I'm gonna start with the older one. Yeah. So when you go to the hospital, and this was a very specific case in the ER, the nurse was not able to find a good vein for my daughter to be able to do her lab work. Okay. When you pull a needle in and out of your vein, it's hurt like crazy, right? Okay. So at a certain point, I told the nurse, can you please pull it out? Because this is not going to work, right? And she and I was very irritated and it was very difficult to stay calm as a mom because I see my daughter looking at me, Mom, I can't take it. Help me, right? Okay. So I told the nurse, this is not gonna work. Okay, we need someone else to help me. Okay. Well, she didn't listen to me though. So I also felt that I failed towards my daughter because basically I let her suffer and I wasn't able to do anything. So the next time when I needed to go to the hematology team, it's the first thing I brought up. This happened. I don't know how to deal with this. It was so frustrating. I said, because that was my safe space because I know the team. And then the hematologist told me, Andressa, but are you aware of the fact that when you see this happens, that you can ask to a specialty team? Because in the ER, for example, there are specialty teams that are able to use, strategies when
Oh
you
yeah,
have difficulties with your veins that they can
yep,
pull the blood in a very easy way.
yep.
And I was like, I had no clue, right? So that was a great way. So moving forward now, I had another experience then where I was like, can you please ask the, specialty team to come and help? They were there in a couple of minutes.
Oh, that's awesome.
So that was great. So discussing in a respectful way, right? With the right people, I got my tools and then moving way. And I'm so grateful for the fact that the team that works with us, They are aware of the fact that sometimes I'm just a mom, right? I might look strong. I might look at, okay, yeah, I'm advocating, patient leader, whatever. But man, when it comes to my daughter, my heart, sometimes it skips a beat because I'm so
Yeah.
scared. So, yeah.
And then they were able to retain you and your daughter as a patient. You were able to get, the care that you needed. So that's a beautiful story.
Yeah.
I appreciate you sharing, your personal kind of life and what's going
Yeah.
on with that as well. I know it's personal, but it really helps motivate us to know that
Mm-hmm.
the work we do is going to make a difference on our patients, even if it's a small thing like the manager giving you a call to ask what had
Mm-hmm.
happened. That's really important. So
Yeah.
that's
Yeah, it is. It's very important. And I must also say that before she called me, I was literally writing an email to the PFAC manager because I was like, being part of the team gives me also a feeling of being confident that I know I'm going to be able to, get my answers. And another thing that I also want to share with people is this: when I call my insurance company and they share a list with me of providers I can choose from, that alone makes me feel confident because if Dr. A is not treating me well, I know I can go to Dr. B. So we have a choice, right? And that is important to know as well as a patient, that we don't have to stick around in an environment that is not working with us. It's like a relationship. If it's not working, next one, right? And the same for this. And that is really something that at a certain point, and I needed to do it for myself, right? When I was going to a specialist for me, I was sitting there looking at a doctor, how he was treating me, but also beforehand when I was on the phone with them. And I just went in to my appointment to let the doctor know that he doesn't run a Walmart. I'm not going there to buy bread. I'm going there because I want answers for something serious, right? And I was so proud of myself afterwards because I was like, okay, and now I can go to the next specialist because I know he will never forget this conversation. It was respectful, but it opened his eyes for sure. He and the nurse were literally looking at me like, what's going on? And yeah,
I really couldn't
yeah.
be more appreciative of you coming on and sharing that with us.
Mm-hmm.
We're going to link your LinkedIn, of course, to the videos so people can go on and learn about it, as well as look at the books you've read and the videos that you've made, as
Yeah.
well as your MD articles. I'm going to be looking at some of those
Yeah.
myself. So I really appreciate you coming on. Thank you so much.
Of course, you're welcome, and thank you for having me.
Of course.